Hello again. Welcome to another episode of Your Pet, Your Vet. I'm Dr. Hilty Burr here at Lake Chatuge Animal Hospital. And today I want to talk about radiology. As you know, the last few shows we talked about how important it was, the physical exam and the history. Remember, pets can't talk to us, so we rely on the family to tell us what's going on so that we can better figure out what's going on if a pet is sick or what its health needs are. That's just so important. However, we also have, just like in human medicine, need to do diagnostics from time to time. Last time we talked about some blood tests we do and some urinalysis. One of the most important things, just like in human medicine, is imaging. It always starts with radiographs or x-rays. And today I want to walk you through how your pet, when it does have to have an x-ray, how we do it, and also go through a few cases with you so you can appreciate how important this is in our efforts to find out what's wrong with the pet when they're presented with a health problem. So let's go on inside and we'll go straight to the radiology room. Okay, here we are with Isabel. Isabel has been having some stomach trouble. She's been vomiting over the last few days, and we've done an exam and some laboratory blood work already, and everything looks pretty good, but we want to make sure there's not any kind of foreign body or any kind of abdominal disease that may account for this. So we're going to take some x-rays or radiographs. This is Kristen. Kristen is actually getting ready here, setting up the digital machine, and I just love digital radiology. It is so much better than the old days because the quality of the film is just fantastic, and we'll talk about that more later. As you can see, Isabel's resting quite comfortably right now. She's relaxed, and that's one of the main points I want to make, is this is a non-invasive procedure and very easy to do. On occasion, some pets have to be sedated because they're anxious. As you know, with radiographs, they have to be still. So that's always the challenge, to make sure that when we take the image that they're still. On this particular view, we want to take a shot of the abdomen. You have to take two views. Kristen's going to do some measuring here so we'll know how to set the machine. She's already taken the amount of the centimeter size with the calibrator, I believe, or maybe not. No, here it comes. Here comes the calibrator. Why don't you go ahead and show them how that's done. And we measure the width of the widest point of the abdomen, and we do it from, that's going to be the lateral view, and then when we get to the next view, you have to take two views because otherwise you won't have a three-dimensional perspective. So here's the fun part, and Isabel's going to be asked to get on her side to take a lateral view. Okay, you're going to hold steady the head. Okay, steady the head. You go very slow, very gentle, very gentle, very gentle. Okay, very gentle. Okay, now with one hand you hold the head down, with the other hand you hold the leg down, all right? Okay, now very good. Okay, you don't have to, keep them relaxed, right? You have to use your voice, right? You have to be very calm. Use your voice. The good Lord gave you a voice to use. Okay, now sometimes when you have to use your hands, you cover them up like this. That's another way to do that. Okay, just be calm. And now, that way we're protected, and you don't need these, and I'll help cover your hands. Okay, very good. Alrighty, turn on a light. Is that how you do it, right? Okay, so I'm going to help you. Now, you need to, it's better to position the table as opposed to the pet, because the pet's happy now, right? So let's kind of move the table. Can you do that? Okay, she's going to move the table. All right. I always like to position the lateral right behind the rib. That should be the last, here's the last rib right here. You had it right the first time. Okay, that's perfect positioning right there. Let's turn off the lights so people can appreciate that. There we go, and there, keep talking. Remember, she's a little nervous, so you need to reassure her. There you go. And then, we always take it on exhale, so Kristen, what she would do is touch the film and take it. It takes just like that. All right, see, very good. Excellent, good job. Okay, now we've taken the radiograph, and all we have to do now is take the plate out and put it into the digital processing. It's so easy. You just push it in there, and it's fed into the processor, and it's really remarkable. And then it quickly, within a short period of time, will actually put the image on the screen. And it's such a beautiful technology, and you can actually manipulate the image. And what that means is that if you have areas that are too dark or too light, you can actually fix that electronically, and you can actually make images. You can make it larger or smaller or focus in on certain areas. To me, radiology is almost as good as ultrasound. Not quite as good, but almost as good. And that's another imaging technique that we also have available, but we always start with radiology because you need that to help direct you what the next step is if additional imaging is needed. Okay, now here's Isabel's lateral view. For sake of time, I'm just going to focus on this because it shows what I want to show. This is actually normal ileus, we call it, gas in the intestinal tract. That's actually the colon right here. And the small intestine is this area right in here. Because he is having a GI event, he does have a lot of gas buildup. But the main problem with Isabel is that she has a distended stomach, and although I don't see any foreign bodies, which is great. So based on this radiographic film, looks like we're dealing with a gastritis, an inflammatory process of the stomach. Should be a pretty easy, straightforward treatment, but we will obviously have to monitor very closely and make sure she responds. But I believe she'll be just fine with appropriate treatment.